New law here in Florida goes into effect. The effort is to crack down on pill mills, but in an effort to catch the bad doctors or good ones getting a bad name as well, we go in depth and find out what this law means for those of us who are patients out there.
Thank you very much, Aisha. There is a new law in Florida intended to reform pain clinics and crack down on pill mills, but there are concerns that it may have unintended consequences. Are the laws so broad they'll corral the good doctors with the bad? And what does this mean for us, the patients? Well, joining us to discuss is Dr. Daniel Kantor. He's medical director of Neurologique. He's the president also of the Florida Society of Neurology. Good morning to you. Thanks for being here, Dr. Kantor. So this law went into effect October 1st.
Right.
What does it intend to do, or what's it trying to do?
Well, let's start with the history. The history is that Florida has a huge problem with pill mills. Basically, people walk in, they walk in with cash, they walk out with bags of oxycodone and Percocet. So the law was intended to curb that, to stop that. That's what the senators wanted, that's what the governor wanted, that's what doctors wanted, and that's what the public wants.
And I guess we would all agree that this is a good thing.
It's a good thing to get rid of it, and there's been lots of stories around town about that. The problem is that the law defines you as a pain management clinic if you advertise for pain services in any medium. That means that your rheumatologist, like in that previous story, who writes down that they take care of joint pain, they are now a pain management clinic. Your neurologist who writes down that they have a headache clinic, even just on a website, is now a pain management clinic.
So if they write help with migraine pain,
they can just write the word migraine, because migraine is a painful phenomenon.
Is that it? Just migraine?
So the problem is that it's so vague, and obviously nobody intended to get rid of neurologists, to get rid of rheumatologists, to get rid of cardiologists who write cardiac chest pain clinic. Nobody intended that. The problem is that if you violate this law, not only do we have to every year get inspected, and every time there's a violation, every day we get charged $5,000 per day per violation. That's not the big issue. The big issue is that we become third-degree felons, and that they can come in at any time and seize our patients' charts without written authorization from you and without subpoena.
Okay, so this is the worst-case scenario, but do you believe that they will, in fact, charge people like you or go in to see people like you, neurologists and others who are treating pain management?
So this is the issue. I called the Florida State Surgeon General. She's very nice, Dr. Viamente Ross. And she said the first thing we're going to do is go into the places that have registered and inspect them. But if we get a complaint from somebody, we have to go investigate it. And if we investigate it and they are violating the law, they're violating the law. So if you have someone who's angry at a physician for another reason, you have somebody who's in competition with a physician for another reason, they may alert the Department of Health, and the Department of Health will come in. None of us want that to happen. All of us recognize that if that happens, probably the neurologist, for example, would win. They would spend a lot of time and a lot of money and a lot of restless nights trying to get out of it, though.
So do you have to now register, you as a neurologist who treats migraine pain?
So what I've done is I've taken off of my website any reference to any sort of painful phenomenon. Not chronic neuropathic pain, not the pain of multiple sclerosis, not the pain of migraine.
But you can still treat for these things.
I can still treat for them, but I can't advertise as such.
Can't advertise. And so for the patient, what does that mean?
That means that a patient who has migraines is going to see a sign for a chiropractic neurologist. And they're going to think that that's a chiropractor that actually is a neurologist, but they're not. They have a place, but they're not. And they're going to go and see them because they're advertising headache pain, facial pain. They don't have the same problem because they don't prescribe any drugs at all. And they're not going to know that neurologists even exist. They're going to think we're just the doctors who take care of stroke, multiple sclerosis, and epilepsy.
So, in other words, if you have legitimate pain concerns, they may not even see that there is a legitimate doctor out there.
And it's not just about treatment, it's about patient safety. And the reason is this: there's a lot more things that cause head pain than just migraine. If you're having head pain and you got pressure in your brain, it may turn out that you have a brain tumor. A neurologist is the person who's most qualified to make that diagnosis, and then the treatment as well.
Well, you make a pretty good argument for that. All right. Dr. Daniel Kantor is the president of the Florida Society of Neurology, also the medical director of Neurologique out in Ponte Vedra Beach. Thanks, Dr. Kantor, for being here.